Introduction to Oral Medicine and Evaluation of Dental Patient Oral Medicine, a branch of dentistry dealing with diseases of the oral and para-oral structures and the oral management of systemic diseases. Also, the diagnosis and management of medical disorders involving the mouth, jaws, and salivary glands. Evaluating and assessing a patient's oral and overall health status is the process, which can be divided into four major overlapping parts. 1. Information gathering. 2. Establishing a differential and final diagnosis. 3. Formulating a plan of action. 4. Initiating treatment and follow-up. Information gathering and appropriate interpretation of the information collected through a medical history and patient examination achieves several important objectives. It affords an opportunity for 1. Gathering the information necessary for establishing the diagnosis of the patient's chief complaint (CC). 2. Assessing the influence of the patient's systemic health on patient's oral health. 3. Detecting underlying systemic conditions that the patient may or may not be aware of. 4. Providing a basis for determining whether dental treatment might affect the systemic health of the patient. 5. Providing a basis for determining necessary modifications to routine dental care. 6. Monitoring known medical conditions. Evaluation of the case. 1. Identification: name, date and time of the visit, date of birth, gender, ethnicity, occupation, contact information of a primary care physician, and referral source. 2. CC: the main reason for the patient seeking care or consultation, recorded in the patient's own words. 3. History of present illness: a chronologic account of events, state of health before the presentation of the present problem, description of the first signs and symptoms, and how they may have changed, description of occurrences of amelioration or exacerbation, previous clinicians consulted and prior treatment. 4. Medical history: general health, childhood illnesses, major adult illnesses, immunizations, surgeries, date, reason, and outcome, pregnancies, gravid births, medications, prescribed medications, over-the-counter medications, supplements, and home remedies, and allergies. 5. Family history: blood relatives with illnesses similar to the patient's concern, specific genetic disorders, cardiovascular diseases, diabetes mellitus, different types of cancers. 6. Personal and social history: birthplace, marital status, children, habits, tobacco use, alcohol use, recreational drug use, sexual history, occupation, religious preferences that may have an impact on types of care. 7. Review of systems. ROS identifies symptoms in different body systems. Review of systems is a systematic approach to ascertain mostly subjective symptoms associated with the different body systems. General: weight changes, malaise, fatigue, night sweats, headaches, tenderness, sinus problems, eyes changes in vision, photophobia, blurring, diplopia, spots, discharge, ears, hearing changes, tinnitus, pain, discharge, vertigo, nose, epistaxis, obstructions, throat, hoarseness, soreness, respiratory, chest pain, wheezing, dyspnea, cough, hemoptysis, cardiovascular, chest pain, dyspnea, orthopnea, number of pillows needed to sleep comfortably, edema, claudication, dermatologic rashes, pruritus, lesions, skin cancer, epidermoid carcinoma, melanoma, gastrointestinal changes in appetite, dysphagia, nausea, vomiting, hematemesis, indigestion, pain, diarrhea, constipation, melena, hematochezia, bloating, hemorrhoids, jaundice, genitourinary changes in urinary frequency or urgency, dysuria, hematuria, nocturia, incontinence, discharge, impotence, gynecologic, menstrual changes, frequency, duration, flow, last menstrual period, dysmenorrhea, menopause, endocrine, polyuria, polydipsia, polyphagia, temperature intolerance, pigmentations, musculoskeletal, muscle and joint pain, deformities, joint swellings, spasms, changes in range of motion, hematologic, easy bruising, epistaxis, spontaneous gingival bleeding, increased bleeding after trauma, lymphatic, swollen or enlarged lymph nodes, neuropsychiatric, syncope, seizures, weakness, unilateral and bilateral, changes in coordination, sensations, memory, mood, or sleep pattern, emotional disturbances. History of psychiatric therapy. The examination procedure in a dental office setting includes 5 areas. 1. Registration of vital signs: respiratory rate, temperature, pain level, pulse, and blood pressure. 2. Examination of the head, neck, and oral cavity, including salivary glands, temporomandibular joints, and head and neck lymph nodes. 3. Examination of cranial nerve function. 4. Special examination of other organ systems. 5. Requisition of appropriate laboratory studies establishing a differential and final diagnosis before establishing a final diagnosis in the orofacial region. Formulate a differential diagnosis (DD) based on the history and physical examination findings. The disorders included in the differential diagnosis will determine which laboratory tests, such as biopsies, blood tests, or imaging studies, are required to reach a final diagnosis. Extraoral examination. Generalized appraisal of the patient face, submental and submandibular lymph node areas, parotid area including lymph nodes, temporomandibular joint area, ears, neck and cervical lymph nodes including supraclavicular nodes, thyroid gland area, intraoral examination, lips and corners of the mouth, mucous membranes of lips, labial and buccal vestibule, gingiva, buccal mucosa, papillae of the parotid ducts, hard palate and palatal gingiva, soft palate, tonsillar areas and posterior pharynx, tongue, dorsum, papillae, ventrum, veins, fimbriated folds, lateral borders, foliate papillae, bilaterally floor of the mouth and lingual gingiva, teeth, occlusion, caries, other defects. Extraoral examination. 1A. General overall evaluation of the individual. Observe the patient as he walks to the dental chair. 2. A patient with extremely large hands may have the disease acromegaly. 3. Swollen ankles may indicate edema due to a kidney or a heart problem. 4. Color of face and sclera, color of lip if there is cyanosis. 5. Observe whether or not there is basic symmetry. Although most faces have some asymmetry, an obvious asymmetry may be due to a dental problem, particularly if associated with pain. An abscess of a tooth or the periodontal tissues is a common cause for facial swelling, once trauma is ruled out. Some asymmetries may be due to swollen lymph nodes or glands. On doing the facial and head and neck examination, the examiner should palpate all of the areas of known lymph nodes regardless of swelling, since a swollen gland may be only palpable and not visible. 6. Pigmented lesions such as moles and age spots and ulcers such as with skin cancers are readily observable and should be questioned. A rash on the skin of the face may be due to an allergy, which can lead to more knowledge about the history of the patient and about future treatment plans. Lymph nodes are concentrations of lymphatic tissue with T cells, B cells and macrophages which recognize antigens and mount a response. When a lymph node responds, it undergoes a hyperplasia with an increase in the numbers of cells. This causes the gland or tissue to enlarge so that it may become palpable. A major component of the immune surveillance system, lymphatic tissue, responds to inflammation, infections and malignant tumors. Any of these may cause an enlargement. For inflammation and infection, the nodes may be swollen, tender and movable. After the insult or injury subsides, then, within weeks or months, the node will return to a more normal size. However, sometimes, as when there is scar tissue or calcification in the node, it will not return to normal size and will stay enlarged. When a tumor grows within a lymph node, lymphatic metastasis, the node will be enlarged, usually non-tender, and may not be movable, especially if the tumor has invaded to the outside of the node. Thus, exactly what palpating a lymph node, positive lymphadenopathy, means. cannot readily be known. Other findings must be used to determine the significance. For example, a patient with an upper respiratory infection, such as a cold, may have several enlarged, tender nodes due to the drainage from the affected tissue sites to the nodes. They will get smaller some time after the infection has passed. Tumor-bearing nodes, on the other hand, will not regress but will continue to expand. The patient would need a medical workup to find the tumor. Lymph nodes are oval or bean-shaped structures found along lymphatic vessels that drain body parts. Normally, they are non-tender, soft, and cannot be felt even though they are present. Therefore, one uses the knowledge of anatomical location of the nodes to perform the palpation to find them. The examiner palpate just beneath the skin with a rotating motion in the areas that nodes would be expected to be found. In most circumstances they will not be felt. However, in young children, with response to so many new antigens, it is easy to palpate nodes in the head and neck. A logical place to start palpating for nodes is in 1. The submental area, below and lingual to the chin, against the mylohyoid muscle. This node is significant because it is the one node that is easy to discover the site of drainage. The lower lip, lower anterior gingivae, corners of the mouth, and skin and tissue of the chin drain to the submental node. Thus, palpating a node there, one should look for a possible lesion in those sites. All of the other lymph nodes do not have as direct a relationship to the area that they may drain, as there are interconnections with other nodes in lymphatic vessels. 2. The submandibular nodes are bilateral and can be palpated by pressing the tissue below the jaw against the medial side of the mandible, or by bimanual palpation with one finger in the mouth and the other externally pushing up. There are 3 groups of nodes associated with the submandibular gland. What one is actually palpating is the submandibular gland itself. To identify these nodes, 3. A group of nodes associated with the parotid gland. It is helpful to have the patient clench the teeth together to make the masseter muscle firm, against which one can palpate for any swellings. 4. Postauricular nodes move the ear lobe aside and look and feel behind the ear. 5. The cervical chains. The posterior cervical chain is along the back of the neck, often positive in infectious mononucleosis and HIV patients. The anterior and deep cervical chain is along the frontal landmark for tracing the anterior superficial and deep nodes is the sternocleidomastoid muscle. Start behind the ear and trace the muscle to the clavicle. Nodes generally are deep and medial to the muscle, which is palpated to try to find the nodes. Then, when reaching the clavicle, one palpates behind the clavicle and along it in the neck. These supraclavicular nodes may be enlarged from disease in the mediastinum or from the thyroid gland. One can palpate the temporomandibular joint by having the patient open and close while the fingers are in the canal or near the tragus of the ear. Any clicking or deviation should be noted, and further questions asked of the patient. If this is found, the thyroid gland may be palpated by putting the fingers gently over the area and having the patient swallow, whereby the gland will pass beneath the fingers. Intraoral examination. The oral examination can start with the lips. Observe the vermilion border in the corners of the mouth for any deviation. For instance, patients who have been overexposed to the sunlight frequently have a loss of the vermilion line and whitish lesions and may have a premalignant lesion. Next, have the patient bring the teeth together to relax the lip muscles. Drape the upper and the lower lips and look at the mucous membrane sides down to the vestibule. On the upper lip, see a maxillary labial frenum as a normal structure. Often, there's a small tab or tag of normal-appearing tissue hanging from this frenum. This is a mucosal tag and may get irritated if caught between the upper teeth. It is a variation of normal. Also noted in some patients along the upper lip near the vermilion are clusters of yellow-white submucosal pinhead glands that are called Fordyce granules. These are ectopic sebaceous glands. that are not associated with any hairs. On retracting the lower lip, see fine white, slightly depressed lines which are scars, usually from falling as a youngster. If the lower lip is held for a while and dried, one can test the minor salivary glands of the lip by noting whether or not mucus is expressed from the many glands of the lower lip. Also note the vestibular area, the gingivae and the anterior teeth. Mucosal tags are tabs projecting from the maxillary labial frenum. Also, note the stippled gingivae and mucogingival line on the left. Fordyce glands on inner aspect of upper lip. Ectopic sebaceous glands appear as submucosal yellowish pinhead-sized papular lesions, often gathered together in clusters as seen here in 2 patients. Retract the corners of the mouth to reveal the buccal mucosae. Here, there are 2 normal landmarks. One is the papilla, an opening of the parotid duct Stenson. Can test the saliva existing from the duct by massaging on the side of the face where the parotid gland is located and observing the flow from the duct. It should be clear or watery since the parotid is mostly serous. A lack of flow or sluggish flow may indicate a dry mouth. Xerostomia causes may be medication-induced or radiation therapy, amongst others. A yellowish salivary flow usually indicates a bacterial infection in the parotid gland, requiring treatment. Buccal mucosa with a prominent papilla of Stenson duct with an expression of clear, watery saliva from the parotid gland. Also, note the large cluster of ectopic sebaceous glands, a common location retraction of the cheek to view the buccal mucosa, which includes the papilla of Stenson duct opposite the maxillary second molar and the occlusal or bite line opposite where the teeth occlude. Buccal mucosa with a prominent white occlusal line and a prominent papilla of Stenson duct. The patient has a habit of sucking in the buccal mucosa and pressing the tongue against the teeth, producing the white lines. Eden toothless hard palate and soft palate showing a bony outgrowth in the midline that is called a maxillary torus. Note the difference in color between the soft and the hard palate, the soft palate being more pink due to lack of keratin, enlarged palatine tonsils with some crypts showing at the surface. Accessory tonsil at the base of the uvula. It is pink and may react and become bigger and smaller. It has a smooth surface in contrast to a papilloma which has a pebbly surface and can appear in this location. Posterior pharyngeal wall in a patient who had a tonsillectomy. Note the raised reddish masses that are reactive pharyngeal tonsils. Vascular tonsillar tissue at the base of the tongue. Some circumvallate papillae are anterior to the tonsillar tissue. An enlarged lingual tonsil, gray arrow. Also, a prominent foliate papilla tonsillar tissue at the posterior lateral surface of tongue, green arrow, and some circumvallate papillae, blue arrows. 2 different patients with enlarged reactive foliate papillae. Dorsal surface of the tongue showing the white filiform papillae and the red fungiform papillae. Dorsal surface of tongue showing a double row of circumvallate papillae running posteriorly to form a inquat V and quat shape. These are raised above the surface and mimic small inquat tumors. Inquat ventral surface of the tongue and the floor of the mouth in a patient with ankyloglossia or inquat tongue tie. Inquat the lingual frenum is attached to far forward toward the tip of the tongue and the patient cannot touch the hard palate with the mouth open. Normal ventral surface of the tongue showing the midline lingual frenum, and the 2 prominent lingual veins running on each side. Also, note the fimbriated folds are lines running parallel to the veins. Introduction to Oral Medicine and Evaluation of Dental Patient Oral Medicine, a branch of dentistry dealing with diseases of the oral and para-oral structures and the oral management of systemic diseases. Also, the diagnosis and management of medical disorders involving the mouth, jaws, and salivary glands. Evaluating and assessing a patient's oral and overall health status is the process which can be divided into 4 major overlapping parts. 1. Information gathering. 2. Establishing a differential and final diagnosis. 3. Formulating a plan of action. 4. Initiating treatment and follow-up. Information gathering and appropriate interpretation of the information collected through a medical history and patient examination achieves several important objectives. It affords an opportunity for 1. Gathering the information necessary for establishing the diagnosis of the patient's chief complaint (CC). 2. Assessing the influence of the patient's systemic health on patient's oral health. 3. Detecting underlying systemic conditions that the patient may or may not be aware of. 4. Providing a basis for determining whether dental treatment might affect the systemic health of the patient. 5. Providing a basis for determining necessary modifications to routine dental care. 6. Monitoring known medical conditions. Evaluation of the case. 1. Identification: name, date and time of the visit, date of birth, gender, ethnicity, occupation, contact information of a primary care physician, and referral source. 2. CC: the main reason for the patient seeking care or consultation, recorded in the patient's own words. 3. History of present illness: a chronologic account of events, state of health before the presentation of the present problem, description of the first signs and symptoms, and how they may have changed, description of occurrences of amelioration or exacerbation, previous clinicians consulted and prior treatment. 4. Medical history: general health, childhood illnesses, major adult illnesses, immunizations, surgeries, date, reason, and outcome, pregnancies, gravid births, medications, prescribed medications, over-the-counter medications, supplements, and home remedies, and allergies. 5. Family history: blood relatives with illnesses similar to the patient's concern, specific genetic disorders, cardiovascular diseases, diabetes mellitus, different types of cancers. 6. Personal and social history: birthplace, marital status, children, habits, tobacco use, alcohol use, recreational drug use, sexual history, occupation, religious preferences that may have an impact on types of care. 7. Review of systems. ROS identifies symptoms in different body systems. Review of systems is a systematic approach to ascertain mostly subjective symptoms associated with the different body systems. General: weight changes, malaise, fatigue, night sweats, headaches, tenderness, sinus problems, eyes changes in vision, photophobia, blurring, diplopia, spots, discharge, ears, hearing changes, tinnitus, pain, discharge, vertigo, nose, epistaxis, obstructions, throat, hoarseness, soreness, respiratory, chest pain, wheezing, dyspnea, cough, hemoptysis, cardiovascular